The National Stroke Association estimates that 80% of all strokes are preventable through risk management. Joining me is Nathan Ernst, manager of Hardin Memorial Health's Intensive Care Unit. Welcome, Nathan.
Thank you, Karen.
Nathan, tell us about how individuals can reduce their risk for stroke.
When talking about stroke prevention, I think it's important to focus on what we can control. For example, if you're a smoker, working on quitting smoking; if you're overweight, working on losing weight, eating a healthy diet, and getting regular exercise.
It sounds, Nathan, like those are personal choices that individuals have control over, like you said. So our lifestyle plays a huge part in our risk for stroke.
Absolutely. It's also important to keep in mind those risk factors that we may not be able to control as much. For instance, high blood pressure, high cholesterol, diabetes, atrial fibrillation, making sure if our physician prescribes us medications for those risk factors that we're taking them as directed by our physician.
And of course, individuals need to take the first step and really find out what those numbers are. So if you haven't been screened, you really need to know your numbers as far as your blood pressure, your cholesterol level, and your risk for diabetes also.
Absolutely. Very important to have regular physicals, to have your blood pressure checked regularly, and to know what those numbers mean, to know what your blood pressure is, to know what your cholesterol is, and then also to know what a normal healthy range is for those numbers.
And I think individuals need to know too that if that medication has been prescribed for you, it is your medication, you need to take it, and you need to follow up with your physician on a regular basis too, because sometimes that medication might need to be adjusted based upon your age, based upon what's going on in your life also.
Absolutely, Karen. Very important to have continuous follow-up, not to miss physician appointments, and to work with your doctor to own your health and to be as healthy as you can be to help prevent stroke.
We hear a lot about atrial fibrillations. So is that something that individuals get diagnosed from their physician and then too would need to lead a lifestyle and make sure that they take medication?
Absolutely. Atrial fibrillation is something that you would be told by your physician, diagnosed with, told that you have that. You would be prescribed some medications to help control your heart, some blood thinners. Atrial fibrillation is one of the top causes of stroke.
Nathan, are there any other risk factors that our viewers should know about?
Actually, in addition to atrial fibrillation, sleep apnea can be a risk factor for stroke. And very important to work with your physician if you feel like that is something that's affecting you, if you're very tired or drowsy in the morning, if you fall asleep frequently during the day. To work with your physician, possibly have a sleep study done, and if you are diagnosed with sleep apnea, to use your CPAP or your BiPAP mask every night to help avoid that potential stroke from happening.
So very important for you to learn your risk factors. We encourage you to find out more information at www.hmh.net. Hardin Memorial Health is an accredited stroke center, and this has been Health in the Heartland.